Welcome to this webinar. Let me introduce myself. My name is Dr. Alex Smallwood, and I'm the Clinical Transformation Director at Health Management. I'm a GP and have over 20 years experience in frontline healthcare services. For those of you who aren't familiar with Maximus, we employ 5,000 highly trained colleagues to deliver services across 285 sites. We specialise in assessments, health, employability and connect services to a range of government and private sector clients. The webinar today, next slide. The webinar today will explore how workplace health can benefit small to medium-sized enterprises, SMEs. I'll introduce you to what occupational health is, and I'll then hand over to my colleague, Amy Cook. She is one of our account directors in our client services team. Amy is responsible for the management and service development for a portfolio of health management strategic clients. She'll look at how occupational health can support business continuity. And then Rob Small, who is the National Disability Training and Consultancy Manager at Health Management, will take you through some of the preventative steps businesses can take to reduce absenteeism and presenteeism. Rob has worked with many organisations across the UK on a consultative basis to deliver health, wellbeing and disability improvements for our clients. As Togsam mentioned, we've got a chance for you to ask questions at the end. Next slide. We're going to cover some of the core benefits of occupational health for small to medium-sized businesses and hope that you find the next hour useful and informative. If you do, please tell your friends and colleagues to look out for future invitations as we have a programme full of sessions over the next 12 months. Next slide. Occupational health is often thought of as a last resort or necessary service only at times of extreme need. In small and growing businesses, it can be seen as a cost, with the value being attributed only to the assurance in due process. This singular function, in contrast to the range of skills and services that go to make up an occupational health services, is just a very small element. There is much to be gained by organisations of all sizes from a proactive approach to employee health and wellbeing, and where required, early intervention. Employers and employees are often conscious of the need for help, but not always sure of the best way to access, or are fearful of what occupational health may mean for them. And there are three main lenses: legal. This in particular covers either specific industries or activities where there is a risk of harm from hazards, be it noise, temperature, chemicals, dust, vibrations, and so on. Here, the health and safety executive places a duty on the employer to make provision. Some industries are similarly covered by additional requirements, for example, transport services and those working with radiation. The bulk of an organisation's employees may not be exposed to risk, but there may be a few roles, such as groundsmen, drivers, night and shift workers, that are also known to have increased risk of secondary health and mental health complications. It can be a challenge to maintain a good working relationship with an employee whilst not wanting to blur the boundaries of straying into medical or subjective medical opinion. You have a moral duty to keep your employees safe and healthy whilst they are working for you. This is as much about the working environment, not just physical, as it is about the roles that people undertake. The financial duty is not just to the organisation to minimise costs, for example from absence, but also to assist employees to remain in gainful employment wherever possible. Using the lenses of benefit, occupational health can also help to maintain loyalty and act as a positive driver for recruitment and diversity. Stable workforces are more productive, with reduced flux and disruption created by absence and presenteeism, where employees are at work but struggling and less productive or impact those around them. Occupational health supports through defined strategies to reduce collective absence, where there are patterns, accelerate return to work through rehabilitation and adaptation based on medical need. There's a significant reduction in absence for employers that leverage the full benefits of occupational health proactively. Whilst occupational health may appear as a cost line, the return on investment is somewhere between £5 and £7 for every £1 spent, so profitability improves due to reduced absence and improved productivity. Small and medium enterprises make up 99% of organisations in the UK and account for 60% of the privately employed workforce. Ultimately, the more successful an organisation is, and the collective weight that SMEs are, the better the UK economy becomes and the less the support burden on those that are unable to maintain employment, and the ability of the UK economy to invest, for example, back into UK businesses. Next slide. Traditional occupational health typically consists of a transactional service, and having an established relationship with a provider makes it easier to access the right service first time. When taken as a transactional service, occupational health, however, is less able to understand the business needs or add value through knowledge of your organisation. So having an established relationship is a much more effective strategy. Typically, after a referral is made, a triage process will be undertaken by a clinician. This may involve requests for more information, such as job description or copies of any notes or hospital letters you may have been given. It may also highlight the need for the employee to add additional information or to have a conversation with you to understand any nuances. OH is there for individuals who perhaps have been diagnosed with a health condition or are struggling in work, having dedicated, clinically led strategy to reduce the burden on the health challenges on them or their role. Examples may include chronic or degenerative neurological or lung conditions. Here, occupational health can guide you, ensuring that any investments that you make are effective and more likely to produce sustained benefits, both physical or psychological. Occupational health can be a trusted advisor with an in-workplace review of the environment or hazards and that contribute towards risk mitigation or minimization. And many SME employers are more actively looking towards a total workforce strategy to maintain a healthy workforce, but may not have a defined or significant budget to allocate. That being said, occupational health can advise based on need and envelope on the best use of the investment available. Similarly, many are opting to provide access to rehabilitative services and EAP solutions, all of which are shown to reduce absence and accelerate return to work. It's imperative, where defined hazards exist, that organisations, no matter what their size, have a strategy in place to protect, screen, and monitor individuals who are exposed to hazards. The normal way is through periodic screening visits from dedicated health and safety executive compliance screening services, often also providing an opportunity for some simple health screening to help maintain general health and wellbeing. Providing the right access to work for those with disabilities is vital, both morally and legally, and not simply a new chair. These services should take a full look at the role and environment and not just, for example, the workstation. Next slide. I've got a little insight here, all based on current Office for National Statistics information, to provide an illustration on the value and benefits of occupational health services. The average absence rate in the UK is currently 2.2%, slightly lower in the private sector, higher in the public. But this has increased predictably since COVID. You can see the flick up in the graph on the left at the end. Unfortunately, this is likely to increase further as the disease burden of delayed access to healthcare as a result of the pandemic becomes more evident. Occupational health and a defined workforce wellbeing strategy reduce absence by up to 70%, maintaining a much happier and healthier workforce in the process. And we know that businesses that use these strategies are included in these overall statistics. This means that there are many businesses with absence rates over 5%, representing a significant burden to that organisation. Absence also varies significantly depending on your workforce demographic. Those with more older and or female workers tend to have higher absence rates, those in Wales, the North East and East Midlands, and those in some sectors, such as the caring and leisure professions. These can be as much as twice the rates found in other cohorts. Next slide. You'll be familiar with risk, and workforce health and absence represents a risk to all businesses, including SMEs. Occupational health is there to assist with each step in managing these risks throughout the careers of your staff. Prevention or elimination is everyone's preferred approach, and this is where occupational health can help you understand your workforce and their unique needs, helping you to build a strategy that anticipates and adapts to both current and emerging trends. An example would be around the shift from site to home or hybrid working, where risks can be hidden. The same is true for risks that cannot be eliminated or prevented. Mitigation strategies to reduce the chances of a risk having an effect, such as ergonomics, adaptations, or protective equipment, are important. And where these cannot be fully effective, minimization through early detection of the effects of risk and analysis of how any mitigations can be improved are important. The world of health and work is constantly evolving, both in terms of new risks and new preventative strategies. For example, we've all heard of asbestos and the risk of exposure. However, did you know that the working with fine particulates such as carbon nanotubes and newer materials can be subject to occupational lung diseases, and that the filters in use may or may not capture them all? This is where clinically led occupational health support is vital to managing elements of workforce risk, in the same way that you'd undertake a fire risk assessment on a regular basis. With minimization and mitigation strategies supported by occupational health, the earlier the referral, the more effective it is. And Amy's going to talk a little bit more about that in just a short while. Next slide. Here, I'm using information from the CIPD, the Chartered Institute of Personnel and Development. I mentioned earlier about the shift in workplace location. To give some context, since the pandemic, working from home has more than doubled to 8.4 million people, many of whom work for SMEs. This has led to a number of positive and negative changes. Whilst employee wellbeing may have improved due to the increased flexibility and reduced commuting, there are secondary hidden effects such as the shift in absence towards non-chronic conditions, but including long COVID, and that people can be present at home, but not well enough to attend work, generating a hidden and increasingly concerning iceberg of need or declining health. Interestingly, we're also starting to see the effect of less mingling, with general immunity to other conditions dropping due to lower circulating levels and less background, low-level exposure to germs. We're also now at the crest of a wave of lengthy delays for treatment due to backlogs in NHS services, something that occupational health can help you navigate if you have a key worker where an acceleration will benefit all. COVID currently accounts for almost a quarter of sickness absence, yet the total absence has only gone up slightly, seeing a change in the pattern of what makes up absence. Next slide. All businesses are unique. Their workforces, their roles, their needs, like a fingerprint. As an occupational health provider, we understand businesses. It's difficult to know if you're the same or different from similar businesses and competitors, and if you're doing all you can to keep your workforce happy and healthy. OH is able to hold medical information, whereas there are risks and concerns for employers holding this sensitive data and remaining impartial in its presence. Relying on an independent expert manages those risks and provides a trusted partner to guide and assist you. Otherwise, this can be a challenge when the employee may have one view, their GP or consultant another. One of the reasons why occupational health exists is to enable decisions and guidance to be produced whilst maintaining independence and impartiality from often the emotion that surrounds occupational health involvement. Employers of all sizes can approach health or disability-based needs with trepidation, as the law can be complex to navigate, frequently with many unknown unknowns. So an impartial, clinically led service can provide the confidence in approach and will have the trust of the employee similarly. As I said earlier, there is a benefit for early referral, if necessary at the point of recruitment or changing to a new role. It is much easier to prevent than to restore. Next slide. Finally, just a few points to summarise what occupational health is and why occupational health is the first port of call. All businesses need trusted expert partners in this space, with the knowledge to guide your business on the risks to health and well-being of your workforce, to develop and deliver strategies to minimise them, and spot trends either in your business, the sector, or role types ahead of when otherwise it might be possible. OH seeks to provide comfort and assurance, particularly when organisations are faced with making difficult employment decisions, but where possible, to avoid this approach through the use of adaptations and evidence-based return-to-work strategies, often overseen by a skilled clinical or vocational rehabilitation specialist. This applies also to reasonable adaptations within the workforce, supporting access to work, and workforce diversity. Ensuring that your obligations, particularly towards health and safety, can be met, and through multi-channel options preventing illness, from a simple seasonal flu vaccination through to an active workforce screening programme. I'm now going to hand over to Amy to look at how occupational health can support business continuity.
Thanks, Alex. Hi, I'm Amy Kirk. As Alex said, I'm one of the account directors for health management, managing a strategic portfolio of clients. If we could move on to the next slide, please. So really, what is business continuity? When we discuss business continuity, we usually refer to being able to deal with unforeseen situations and disasters. Most recently, health management has supported hundreds of organisations through the global COVID pandemic. From assessing individual vulnerability and providing mental health and musculoskeletal support to home workers, to the delivery of large-scale testing programs to major manufacturers, ensuring they continue to function and in turn help protect the national supply chain. As an occupational health provider, we go much further than this. We can support the health and well-being of your employees and in turn your business, ensuring day-to-day fitness and readiness to tackle challenges when they occur. Next slide, please. Recruiting the right people is vital for any organisation. Time and money are invested in finding those with suitable qualifications and experience. But are you sure the candidate is medically fit for the role they're applying for? Completion of a health assessment questionnaire is a quick and cost-effective way to ascertain this. And while employers often ask health-related questions as part of the application process, few have someone who is appropriately qualified to review that information. Our expert clinicians can provide impartial advice on both overall fitness for role and any possible adjustments that might need to be recommended to support you make an informed decision, avoid costly hiring errors, and ensure you're prepared to provide your new colleague with the best possible introduction to the workplace, whether that's by ergonomic equipment or neurodiversity support. Next slide, please. Absence has an impact on all businesses, but the cost of unplanned absence is usually much greater than just the sick pay. Using agency cover or offering overtime to other employees immediately increases operating costs. Add to that the loss of income from lost opportunities, the impact on resource levels, which for smaller organisations is usually felt much more acutely, and the impact on those filling the gaps, and the ripples spread far wider than it might initially seem. A government policy paper on improving lives, the future of work, health and disability noted that a significant proportion of the UK employees are employed by small and medium-sized organisations. NICE and ONS data from 2009 also states that 1 in 5 who are off for 4 weeks don't return to their previous role. Greater than 50% of those who have been off for a year don't return to their previous role. And those who have been off for more than 2 years are actually more likely to die than return to their previous role. Next slide. Management referrals provide employers with impartial expert advice in relation to an existing employee's fitness for role and support in relation to return to work and management of health conditions. Using this service in a timely manner can effectively prevent or minimise the duration of absence, as well as supporting managers in making informed decisions and managing risk in cases where difficult and complex situations occur. The enormous benefit of being able to access this on an ad hoc or pay-as-you-go basis is the availability of expert advice without an ongoing financial commitment, and the ability to avoid delays, which are often experienced when seeking support by NHS resources. Next slide, please. The role of the occupational health provider is to ensure that employers are aware of their statutory obligations, as well as providing management referrals and other return to work support. For example, did you know that where an employee's role exposes them to certain risks, there is a requirement to monitor the effects of these via regular health surveillance? When making decisions, it's also important to ensure that appropriate advice is obtained. Where GPs are often willing to provide advice on return to work, they don't always have specific knowledge about a person's workplace or role. It might be difficult for them to understand the implications of someone's condition and that the ability to do their role as a result. Next slide, please. Night workers also need special consideration and access to regular health checks. These must be undertaken by appropriately qualified clinicians and a record kept of when they have been offered, regardless of uptake. Many people are unaware of the risks that night work can cause, disruption of natural sleep cycle, and a number of other issues. Really important to get those checked and for those employees to be monitored. Next slide, please. And finally, occupational health doesn't just deal with the issues and monitor the impact of the workplace on health and vice versa. It can also support with proactive measures to enhance both the health and wellbeing of your employees and in turn your business. My colleague Rob will now take you through how this works.
Thanks, Amy, and everyone for joining us today. As Alex mentioned, I head up our training and consultancy division, effectively working with clients and customers to achieve their overall health and wellbeing aims. So today I'm going to provide you with an insight into how you as an organisation can be proactive in supporting health and disability within the workplace. And to achieve this, we've broken this down into 4 bite-sized and more manageable steps. So stage 1 is focused on understanding and unpicking your business. Stage 2 is about ensuring you have the right tools for managers and colleagues. Stage 3 is having the best and most appropriate resources in place to support colleagues. And stage 4 will explore additional activity to support your business in creating the best culture. So starting with stage 1, focusing on you personally understanding your business, and we're going to be looking at disability confident first. So being truly disability confident is about creating a movement of change for your organization and being a unique opportunity to lead the way in your community. It's about taking action to improve how you recruit, retain, and develop disabled people, whilst helping you to attract a wider pool of employees with varied skills and different approaches. We know that disabled people make great employees. They bring motivation, passion, and the skills any business needs to succeed. Plus, employers report better team morale and a more positive atmosphere in the workplace as a result. Linking that to the start of your journey to becoming disability confident is by completing a full organizational assessment. It's about taking an inward look at your business, and it's a great place to start your journey. By utilizing the Disability Confident Framework, this will provide you with the foundation areas to focus upon whilst identifying good practice and areas that can be improved upon over a period of time. We fully appreciate that this journey can be daunting for some businesses, and for some of you, you may not know where to start. And also, in fairness, you may not have the answers to all of the questions that you want to ask. You may also want an independent or impartial view on your business, which is perfectly understandable. So not to worry, we can support you on your journey. We do this by providing one-to-one business consultancy via our experts every step of the way. Our services assess key areas of your business, including recruitment processes, diversity and disability training, policy and procedure reviews, internal and external communications, which will also include your websites and social media channels, wellbeing services offered to employees, supply chain arrangements, and HR or employee-related data. We'll provide you with a good practice guidance element and a tool that will help you assess your business and collate evidence. Following this, we'll analyse the evidence that you submit and present you with a report, which not only recognises your good practice, it provides identification of gaps or actions to take as a result, as well as recommendations for continuous improvement within your business. We complete the self-assessment documents required to achieve level 2, whilst providing you with specific guidance to achieve level 3 disability confident leader status, or at times we may request further evidence if required. Then, when you have the right evidence in place, we'll validate you at level 3 and provide you with a completed validation template. Another area to focus upon on your business assessment is a review of accessibility of your working environments. Excuse me. It's important, it's more important now than ever to focus not only on working environments, but also the hybrid working and people working from their home environments. Considering colleagues working from their home environments, not just that of the business premises that they're based within. Stage 2, moving on to the next slide, please, is focused on creating the right tools for your business. So creating an inclusive wellbeing strategy for your business is ultimately achieved by completing stage 1 first. The report of findings can feed into and be the base framework for your ongoing organizational wellbeing strategy for your business. Ensuring that you have the best policies and procedures in place is vital to the success of supporting disability effectively within the workplace. By completing a fully comprehensive review, this can aid you in ensuring inclusivity and guidance for managers and ensuring that it's provided within all documentation. Understanding that what works well on paper does not always translate into the working environment is also vital. By reducing those grey areas within your policies when it comes to disability is definitely the key. And also bringing these to life via different workshops, case studies is also a great way to gain buy-in and engagement with your people managers. Looking at accessible communications and training, for example, are often areas that are missed during rollout of items such as business updates, mandated training, or colleague calls, all of the elements that ultimately are your lifeline for communication and upskill of knowledge of colleagues often are missed in terms of understanding accessibility. So by considering these areas as part of your ongoing strategy, it can certainly help in creating a far more inclusive working environment for all. Moving on to stage 3 of your journey, it's all about ensuring that you have the best possible resources in place. So looking back to the information that both Alex and Amy have shared with you in regards to occupational health and in relation to things like EAP, linking into that, so employee assistance programs, Naturally, one of the key resources within your business is OH assessment and effective case management. We know that it can be a vital resource for managers and colleagues. EAP services for all colleagues. We know from a general viewpoint for organizations that these are underutilized. Considering what you can do to increase utilization should form part of your strategy, and it's important not to be overlooked. And we can provide a tailored vocational rehabilitation workplace adjustment service to meet your organization requirements where required, or you can potentially manage this yourselves internally in terms of creating a dedicated resource to that service if that's something that you think would be appropriate. Utilising the access to work services to aid in funding reasonable adjustments for employees is a great way to create an inclusive workforce whilst also saving your business the expense. In addition to this, the funded or free service to support mental health in the workplace is called the Access to Work Mental Health Support Services and is provided by our sister company, Remploy. Cases are managed by specialist vocational rehabilitation consultants for up to 9 months, and their aim is to produce a wellbeing focused plan on equipping the individual and the organisation with the tools and strategies to stay within, return and remain within the workplace. Things like disability passports, RAPs, which are wellness recovery action plans, and risk assessments are tools and examples to guide you or your people managers in having helpful and meaningful conversations with colleagues within your organisation. Following this session today, we'll be sharing those resources with you. They're designed to equip both the individual and the manager with the knowledge on how best to support their requirements within their role. We do recommend, however, that these items are reviewed on a regular basis as part of day-to-day one-to-one conversations. Most importantly, it's about that cultural change and that communication, the what's in it for me scenario from both an individual and a people manager perspective, and gaining that buy-in and engagement from those groups. Exploring partnering with disability-specific charities is a great way to obtain support for your organisation around specific themes. And there's a raft of online resources, communities and apps available to support your wellbeing and that of your employees. Headspace, for example, is a great tool that can support individually around the wellbeing overarching topic. Next slide, please. So stage 4 is the final stage, and it's about creating the best culture for your business. Creating a level of foundation knowledge and confidence within your business is vital to the success of managing disability effectively in the workplace and creating that all-important cultural change. We have programs that are tailored to focus on key areas to build confidence, knowledge, and appropriate networks to support your aims. A selection of which can include things like disability-focused programs all around creating an awareness as disability as more of an overarching pan topic, exploring a lot of the stigma and discrimination, things like the Equality Act and reasonable adjustments, very much equipping managers with the ability to be able to support disability effectively in the workplace. We have programs that focus on the topic of health. So some examples of that would be things like long COVID, menopause, driver health. They're all designed in the same structure in terms of exploring those topics from the ground level up, and very much focused on how to effectively support that within the workplace. We have mental health focused programs that equip both managers and colleagues with the skills and abilities to not only support their own well-being, that of its customers, but also that in terms of from a managerial perspective, supporting from a colleague point of view that they're responsible for. Resilience focused programs focused on individuals looking inwardly to themselves around both the personal and professional elements that could be impacting or creating a more positive change in those individuals' resilience, and how best to equip them with the tools and processes to be able to support that effectively moving forward. And on the flip side of that, we have the managers focus program that very much again looks inwardly from a managerial point of view, but also from a perspective of how best to support and equip individuals that they're responsible for with the right tools and processes to support that effectively. Other popular programs include mental health and suicide first aid. So very much focused from creating a network of specialist individuals within the business, all around things like signposting and support mechanisms that can be really useful referral points for managers or colleagues to be able to gain access to relevant information. And we have champion focused programs that are around equipping businesses with the right tools and skills within their organization. And that's a bespoke service that's all designed around elements of change for that business, depending on what the business wants to achieve. Workplace adjustments, ensuring that your recruitment processes and policies explore the need for reasonable adjustments prior to the commencement of employment for an employee is vital for success. And this is often overlooked by organizations and certainly an area to focus upon as part of your organizational assessment. Things like mystery shopping your recruitment processes, using the lens of someone with a disability to be able to understand how accessible your process is, all the way from job advertisement, application processes, interviews, and then the all-important onboarding process can provide you with vital information around how best to make it more accessible as a business. And then for those that are in work, we know that around 78% of disabled people acquire their disability at age 16 or older, which means that most people will acquire their disability within their working lives. So you must ensure that support needs or reasonable adjustment conversations take place on a regular basis throughout the individual's journey of employment with your organisation, and raising awareness across colleagues and managers to explore these topics on a consistent basis is vital. By normalising disability in the workplace via communications and case studies, this can support colleagues in recognising areas that they may well require support within. This can also increase your line manager confidence in having helpful conversations with their reports, considering items such as employee case studies, employee blogs, awareness campaigns, and creating things like a calendar of events or days that you would like to focus on key topics throughout the year can aid in awareness raising. So in summary, moving on to the next slide, please. We've broken this down into 6 steps because I appreciate I've shared a lot of information during the last few slides. So step 1 is around understanding your business. Celebrating the good and identifying areas of improvement will make your journey to success more achievable and stand the test of time. Step 2, equipping your business and its managers with the right tools and processes and policies will ensure a consistent approach across your organisation. 3, by planning your strategy through accountable steps with timelines, this will make your journey to success far more manageable and less daunting. 4 is around exploring resources that already exist, providing access to specialist services, and partnering with specialist organisations will equip your business and its employees with all the support mechanisms and knowledge that it needs to support and retain disabled talent within your organisation. 5 is sharing success across your organisation, utilising specific calendar dates to mark disability themes and raise awareness amongst colleagues will all help in building disability confidence and a cultural change within your business. And finally, step 6 is continually developing your organisation's employee confidence and knowledge is a vital step in the success of your journey. So thanks once again for your time today. I hope you found it useful. I'm now going to hand back over to Togshan for your questions.
Thank you, Rob. So just a reminder, if you have any questions to ask, please use the Q&A button at the bottom of the screen. We had a few questions submitted to us before the call by some of the attendees, so we'll try to go through them during this part of the call as well. So the first question is, I often see a phased return to work as an option on a certificate provided by the GP, but there is usually no context or milestones for the recommendation. How should I approach a phased return to work? Would one of our panelists please answer this question?
Yeah, so I would probably say that this is a common question that gets asked, and it's a common reason for a referral to happen, where a business might be struggling to understand what's the best approach. You know, for example, following a period of illness, and you know, a 2, 4, 6, 8 week return to work may have been recommended, often with different points. You know, for example, daylight work or mixed days or whole days, but spread out. I think if it's a challenge for the business, and it's not clear, I would always say, come and get some specific guidance. You know, that's exactly one of the reasons where a management referral can be helpful. It's actually putting that phased return into the context of the role and the environment that person is working in. So I would suggest that's a good way of, and an important place to reach out. Often that's also so a doctor may give a certificate that says, return in a phased way over 6 or 8 weeks, but actually they may be able to return faster than that with the right support as well. So I would say, don't just look at it in terms of how you can break down the phased return, but actually how can you accelerate the return in a supported way. And that's kind of what occupational health can help you do at that point.
Thank you, Alex. We had another question. My staff see occupational health as a bad thing. What can I do to change their perceptions? Who would you like to answer that one?
I'll take that one if that's okay. It's a topic that we discuss with clients on a very regular basis, particularly where there's sort of heavy unionisation. I think, yes, in the past, occupational health, for the wrong reasons, had a reputation for being the stick rather than the carrot, and it's absolutely not that. What's really important is actually the conversation that you have with your employee before you go ahead and make that referral, so that they understand why you're making it, the things you want to ask, and how it actually benefits you both as part of the process. I think the more invested you can get them in the process and the more engaged they become, they're likely to actually engage with the nurse or the doctor that's doing the assessment with them, but they're also more likely to share relevant information and useful information for us to give you a helpful advice report coming out of that.
Thank you, Amy. This is great.
Add to that, in terms of following on from what Amy said, I mentioned in terms of things like case studies and guidance. I think often people only access things like occupational health services when there's a need or there's a support requirement. So naturally, there's going to be a little bit of ill feeling or concern around how that's going to shape and feel. But by actually using case studies within the business to be able to share some of those examples of where occupational health has really added value, can be really beneficial to normalise that type of service, but also share success for sure, and perhaps reduce some of that stigma that's attached to it from traditional viewpoints.
Thank you, Rob. Thank you both. This was really helpful. So the next question is, we're seeing a lot of staff off for protracted periods of time due to being on NHS waiting lists. Can occupational health help us navigate or accelerate these challenges?
Yeah, I'll probably pick up this one, and then Rob, you might want to come in just at the end as well. So yeah, this is certainly a common problem and is likely to be an increasing problem, as I mentioned earlier. NHS waiting lists can span both making a diagnosis and also the following on from an intervention or waiting for an intervention. So there's different elements and areas where this might be important. For example, if you take someone with a knee problem, they may be waiting for a diagnosis, and in the meantime fearful of potentially injuring or making their health condition worse. And so facilitating access, occupational health is one of the things that we can do is accelerate access to those specialist consultations, for example, so that the diagnosis can be made earlier. The person with the knee problem may actually only need some lifestyle changes or some behavioural science changes, for example, perhaps mobility, lifestyle, weight management, but potentially they may also only need, for example, an injection rather than an operation. And all of these things go some way to reducing the 18-month waiting time to 12 months to 4 months, for example. But the same applies out the other end as well, that actually sometimes there's a value-based decision to be made on, for example, paying for an intervention on behalf of somebody, and we can help you facilitate that at pace if required. And similarly, so, for example, post-intervention where someone might need some rehabilitation. So at each step of the journey, I think there's an opportunity to accelerate. You don't have to wait for any particular milestone to have been reached. I would always say, if you have the opportunity to do it quickly, particularly if that's a key individual who's preventing a team from being productive, then the sooner you do it, the quicker the recovery.
Thanks, Alex. Did you have anything to add, Rob?
It's really just an echoing of what Alex was saying, but ultimately not everything necessarily needs that NHS intervention, and it's not kind of a standard approach to necessarily say that. But in terms of occupational health, obviously, as Alex said, can accelerate that pathway and get those clinical judgments. Also, things like, as we talked about, the workplace adjustment assessment programs that potentially we could facilitate for organisations, increasing line manager confidence and knowledge around appropriate adjustments and support mechanisms that they can be implementing themselves in the workplace can also be really beneficial from experience, that again can remove that need to be waiting for those NHS times for sure. But it's almost a follow on an echo of what Alex has said, to be fair.
Great, thank you. We had another great question that was submitted to us earlier. I'm a small organization, so the budget is small. What should we focus on? What should we prioritize? Would anyone like to pick up this one?
I'm happy to go with that. I would always start by saying, let's have a look at what your absence patterns, what your challenges are within your business. Target your intervention towards the area where it's most likely to be effective. If, for example, you know you've got a lot of mental health based absence and illness, the solution may be to put some mental health support in there, or it may be to undertake a review of the working environment and job roles to see what it is about them that may be exacerbating, for example, underlying mental health difficulties. So I would always say start by having a look and trying to be wise and intelligent about what you pick and the services that are available. So, you know, sort of the consultancy services that Rob was talking about earlier can certainly help you to identify and prioritize that.
Thank you.
Echoing that again, we're doing a very good double act here, Alex, in all. But definitely that organizational assessment piece, I think, is key. So rather than almost throwing mud at the wall and hoping it sticks, it's taking that step back. If budget is small, actually a lot of those elements that may come out of that organizational assessment you may want to do internally, which reduces that cost and ultimately uses the resource that you have within your business. But it is that importance of unpicking what are those priorities for you as a business and then planning accordingly that can be the most cost effective use of what can be quite small budgets, which we appreciate.
Thank you both for the great advice. Another question is, as a small company, sometimes I just need a bit of advice and I don't know if I need to make a referral for occupational health services. Where can I access this guidance to prevent incorrect or inappropriate occupational health service use?
Sure. Perhaps I'll start. I mean, we often have conversations like this with existing customers as much as those who are exploring occupational health services. And it's I would say start by having the conversation, you know, through, for example, the occupational health advice lines or something of that nature. They can guide you based on perhaps a small vignette conversation around the difficulty you're facing about what the right service may be. And steer you to a service. Certainly from an occupational health perspective, we would always ensure that there's clinically guided triage in there. So you would never be pushed towards an incorrect or inappropriate service. But it's, as you say, sometimes you might find yourself being put into a position where you're going, actually, I'm not sure whether occupational health or rehabilitation or return to work solutions or any of the others might be the right place. So I think the first thing to do is have a conversation with us and take some guidance.
Perfect, thank you. We have a final question that was asked us previously. If anyone else wants to submit a question to Q&A session, this is the time to do it. The question is, whilst the preventative steps seem like a good idea, resources tight, how can we implement this and how long does it take?
So yeah, I'm happy to take that one. It's a very broad question in all fairness. So I kind of feel like the response is how long's a piece of string in all fairness, because it depends on the size, the scale, the makeup of the business and how much someone wants to achieve. That being said, I think it goes back to the point I was making at the beginning, which is all around unpicking good practice and areas for improvement for the business, but then creating a manageable bite-sized plan that sits behind that. I think if you try and tackle everything all at once, that's going to be unachievable, in all fairness. So focusing on particular areas for your business can be quite short, sharp interventions, i.e. recruitment as a particular theme, can be mystery shopped, can be assessed. You can look at exit data, all of that type of stuff, and employee data. And actually that's stuff that's generally readily available and freely to look at, that can tell you quite a good story as to how that's shaping and looking and feel from a disabled employee perspective. Also things like training, you know, we have longer programs, we have shorter programs in terms of that knowledge uptake. I guess what I would say in that sense is what we tend to do is not a one size fits all type approach for any organization. The key there is to enter into a conversation with us in terms of being able to explore what it is overarching you as a business would want to achieve. And then we can discuss core milestones and elements that perhaps would wrap around that and sit behind that, and which elements you want our support with or to hold your hand on that journey with, versus which elements perhaps the business wants to take internally. And we can work with yourselves to be able to define what that looks and feels like. But it can be very quick, but ultimately it depends on the business, I guess, is the general response I would give.
I'd probably just add to that, if you're thinking about this from an individual perspective rather than necessarily an organizational level as well, things like adaptations, ergonomics, and access to work, for example, they can all be made incredibly quickly, and it's all about the sooner that you raise the question, the quicker the change can be made. So typically if somebody's being prevented from returning to work because of a missing piece of equipment, then using a well-oiled process to get that, for example, delivered or installed or adaptations made can really accelerate that to sort of hours and days rather than weeks and months. So yeah, there's sort of two sides. There's the organizational side and there's the individual side, I think.
Thank you all for the great answers. So this concludes our presentation for today. Thank you for attending today. We hope it has been useful. As I mentioned, the recording will be shared. Later. And if you have any questions after this webinar, please feel free to email us at workplacehealth@maximus.co.uk. Thank you very much.